Brain cancer or brain tumor is definitely one of the most dangerous cancers that is known to us. So, the thing about most of the brain tumors is that they don't spread to other parts of the body. But brain is such a compact structure inside the skull that even a compromise of 2 or 3 centimeters of space inside the skull makes it difficult for the brain to function normally. There are at least 80 to 90 types of brain tumors. They arise from different small parts of the brain. We all know that brain is not a single structure. It is made up of multiple organized, specialized parts which have different functions so that we function normally. So, what brings a patient with brain tumor to the oncologist? There are various symptoms that brain tumor can cause, and that again depends on which area or which part of the brain that the tumor arises from. So, there are patients who present to the emergency with seizures or fits, that would call it. Long-term headache, which is increasing in severity, is one more symptom that many people see. Sometimes they can come to us with weakness of certain parts of the body, like weakness of the limbs. Sometimes they may have speech disturbances. They may have disturbances in memory, vision, hearing, and so many other things. Sometimes brain tumor patients can even present in coma. So, the first investigation that we would do for a patient who has severe symptoms related to the brain would be an MRI of the brain. So, the MRI of the brain would help us to not only localize where the tumor is located in the brain, but also to then help in deciding whether surgery is possible to remove the brain tumor or not. So, like I just told you a little while back, each part of the brain is not expendable. If you remove certain parts of the brain, it could lead to paralysis, it could lead to severe dysfunction of various functions of the body. And there are also individuals who after a brain surgery have never got back to a normal life because of the loss of certain critical structures of the brain. Many a times a patient with brain tumor is faced with a dilemma of deciding whether to get the tumor removed and then develop neurological abnormalities or incapabilities versus dying. And the patient usually chooses undergoing a large surgery which can probably alter the normal functioning of an individual. So, what are the strategies to treat brain tumor? Many brain tumors, as I told you, are benign, and if they are benign and are completely resectable by surgery, brain tumors are highly curable. If they are aggressive and spread across the brain by invading the various barriers that are present inside the brain, then it is not possible for them to undergo a complete surgical removal of the tumor. In these cases, it is required to add radiation to the treatment strategy, and radiation effect can be augmented by giving certain chemotherapy drugs which can help in increased destruction of the tumor. So, what exactly happens is that after a surgery is done to remove as much tumor as possible, we call it as the maximal safe resection of the brain tumor to the area surrounding the maximal safe resection area or the tumor bed or even the surrounding regions of the tumor area. We give highly focused radiation to the brain tissue to help kill all the cancerous cells or all the tumor cells in that region. By this method, you can avoid removal of many critical structures of the brain while still giving radiation to kill the tumor cells. Many brain tumors present in the pediatric age group, young kids coming with brain tumors. In this age group, sometimes radiation cannot be given. So, for these kids, many a times we utilize the strategy of giving chemotherapy, keeping the tumor under check, waiting till the child turns 3 or more than 3-year-old, and then possibly give radiation therapy to the tumor. There are certain cases where the tumor in the brain is because of a spread to the brain from cancers of the lung, breast, or so on and so forth, at which point the treatment of the primary, that is the treatment of the original tumor along with radiation therapy to the tumor area in the brain helps to control the tumor. Last but not the least, it is very important for us to remember that many brain tumors have a genetic origin. Some brain tumors which have what we call as aggressive genetic mutations may not do well despite the best of our treatment. But patients who have less aggressive tumors with favorable genetic profile or genetic damage profile may do well with therapy.